Milani. My name is Alex. I'll be your nurse today. Can you please tell me your name and date of birth?
I'm Milani, February 10th, 1998.
Okay, and how are you feeling today?
I'm alright, I'm just here for my annual physical.
Okay, let's start by checking your vitals.
Alright.
Okay, and okay, you're going to feel some pressure on your arm. And let's check your temperature. Stick that under your tongue, please. Okay, thank you. Okay, let's take this off of you. And I'm just going to check your pulse, okay? So, okay, and just like that. Okay, great, thank you.
No problem.
I'm going to ask you a few questions about your health and medication history. Do you have any past medical history I should be aware about?
I have asthma and type 2 diabetes, and I was recently diagnosed with schizophrenia.
Okay, thank you. Do you take any medications for these conditions you just listed?
Yeah, I take an emergency albuterol for my asthma, and I take Clozapine for my schizophrenia. I treat my diabetes with diet and exercise. I'm slowly getting better.
Okay, that's good to hear. Those drugs are common for those two conditions. Do you understand what those medications do?
I know what albuterol does, but no one really explained Clozapine to me.
Are you interested in learning what Clozapine is used for?
Yeah, that sounds good to me.
Clozapine is a drug that is very commonly used to treat schizophrenia. Its generic name is Clozapine. Does that ring a bell?
Yeah, I think I've heard that before.
Clozapine is used to treat schizophrenia when the patient doesn't respond well to other standard types of therapy, and it reduces suicidal thoughts as well.
Yeah, ever since I started taking it, I felt less hopeless and a bit more calm and stable.
I'm glad the medication is working for you. Do you know how the drug works?
No, but tell me, I'm interested to know what this drug does to my body.
The drug reduces schizophrenic and suicidal behavior by binding to dopamine receptors in the brain.
Dopamine receptors?
Schizophrenia has been heavily related to too much dopamine in the brain. Dopamine is a chemical in your brain. When the drug blocks the dopamine receptors, it reduces the amount of dopamine acting on your brain, which can reduce schizophrenic symptoms. Does this make sense to you?
Yeah, that actually makes a lot of sense.
Can you describe to me how you take your medication?
I take the pill out of the bottle and I swallow it with water. Is that how I'm supposed to do it?
Yes, that's exactly how you're supposed to do it. Do you know of any of the possible side effects the drug can give you?
Not really, I just know that it's supposed to help me.
A few of the possible side effects are called neuroleptic malignant syndrome and agranulocytosis. Do you know what that is?
I'm not sure.
Agranulocytosis is when your white blood cells reach an abnormally low amount. Neuroleptic malignant syndrome is a severe reaction that some patients have when taking medication like Clozapine. You need to be cautious if you develop symptoms like high fever, rigid muscles, and a fast heart rate. If you experience any of those symptoms, you need to call your healthcare provider.
Okay, I'll keep an eye out for those symptoms.
You also need to be cautious of a condition called agranulocytosis. It's a condition where the cells in your body that fight off infection are decreasing at a dangerous rate. When you get lab work done, alert them that you're taking this medication. They'll pay close attention to the levels of those cells to make sure you're staying healthy.
Okay, I'll let my doctors know.
There are two more side effects I want you to know the details of. The first is myocarditis.
What is that?
It's when the muscles in your heart become inflamed. If you're experiencing anything like unexplained fatigue, shortness of breath, or chest pain, make sure to alert your healthcare provider. These can be signs of you developing that condition.
Okay, what about the other side effect?
That's called tardive dyskinesia. This usually appears as repetitive jerking movements that occur in the face, neck, and tongue.
Should I let my doctor know if I experience that?
Absolutely. Some other general things to keep an eye out for are rashes, sweating, weight gain, nausea, and dizziness. You're also going to want to keep an eye out for blood glucose levels because high sugar levels are associated with this drug.
This is a lot of information.
I know, but it's all important to keep you happy and healthy. Can you try reciting some of the information I told you so I know you understand?
Sure, I have to keep an eye out for high fever for that neuroleptic thing. I have to ask my doctor to keep an eye on cells that fight infection so I know they stay up. I gotta tell my doctor if I'm short of breath or unusually fatigued, and I have to let him know if I'm having jerky movements in my face.
What do you have to be aware of with your diabetes?
I have to closely monitor my levels because this drug can make it increase.
Good, I'm glad you understand.
Is there anything else I should know?
Yes, if for any reason you miss your dose for more than 2 days, stop taking the drug. Go back to your doctor to adjust your dose. Are you a smoker?
Yes, a pretty heavy one.
You should really try your best to decrease your smoking until you quit. Cigarette smoking can decrease the levels of the drug in your body and allow schizophrenic and suicidal symptoms to recur.
I don't think I can stop smoking.
It's a hard process, but with the right tools, it'll be done with as much ease as possible. I'm going to give you a pamphlet on smoking cessation tools when you leave, so you'll have a bunch of options to help you live a healthier life.
Thanks for that, I'll try my best.
That's great. Lastly, I'll make sure you take the medication exactly as directed, 100 milligrams per day.
Yep, that's what I do now.
Perfect. Do you have any more questions for me?
No, I think you covered about everything I was really confused about. Thank you for explaining it to me. It really helps me understand the drugs I'm taking better.
No problem. It's what I'm here for. If there's nothing else you need, you can head out and see the woman at the front desk for some paperwork.
Thank you.
You're welcome.